two Nobel laureates from this place. So you can imagine our great Rabindranath Tagore and Amartya Sen, one from economy and one for literature, two Nobel laureates from one area, that is in Bolpur, speaks volume about the influence of this place on making great people here. So now I come to the young doctors who are now in the 4th batch, who are about to take their final year exam and then become interns. So I wish them very best for the exams. Exams are important. You need to pass the exams. And Dr. Prabhakar Reddy has, as a senior teacher, explained the 4 Ds about successful doctors and how to be a good doctor. The number of students who reach good heights in their respective field is because of hard work, dedication and due diligence to very, very minute things. I can give you a very perfect example of our non-medical example, why there are only few who have reached the top. As we can see, coming back to cricket, which is my favorite also, like many of us, there is only one Sachin Tendulkar, there is one only Virat Kohli, but they did not just come because of talent. They were clever, they were intelligent, but they were dedicated, hard-working, they are disciplined. That is why they reached the top. We cannot have hundreds of Virat Kohlis in India. You can understand that. We don't have hundreds of Sachin Tendulkar in India. Similarly, out of 100 students who pass the exam every year, there is 1 or 2 who will outshine, who are different, who are very hard working. And we do not know whose talent is there in that hundreds of students who reach the top level and have made a name for themselves. And those few students may not be very prominent in the class, but they are very silently working, very hard, very sincere, and trying to learn from everybody. So again, coming back to Dr. Prabhakar's the 4 Ds that he has said, I reiterate that because I come from a very small town called Bellary in Karnataka, and it is a very small government medical college. We had to learn a lot of things on our own and the teachers were there, but it is the thirst of the student which is very important. The thirst is where you get the passion to go and learn from different people what all they know, and spending sleepless nights reading, putting things into practice. Just knowing knowledge is no good. You have to put the knowledge into practice, especially in medicine. Passing the exam is one part, but applying what you have learned is the key to patient care. At the end of the day, as doctors, surgeons, radiologists, pathologists, we all have a duty towards patient care. We have to make sure that the patient benefits from our knowledge, and the best results are there when we decide that every patient needs the best treatment. For example, as doctors in the family and your extended family, any problem in the house or in your family, they will contact you and they say, oh, this relative has this problem, what should we do? Either you are able to treat, either you are able to make a diagnosis, and then you refer and talk to people and help them out. Since you want the best treatment for your relative, the same thing applies to everybody who comes to you, that they also deserve the best treatment. Because a patient has relatives, an extended family, friends. So you can approximately see that one patient has on an average of 40 to 70 relatives and friends all around him. So if you were to do good work for the patient, 50 people of the family and their extended family and their extended friend circle know about you. So you don't need to do any advertisement, any kind of gimmicks of saying I do this, I do that and all that. Your work and knowledge and how you talk to the patient will make people come to you wherever you are. So studying in MBBS is the key foundation for your growth. As you all know, I was yesterday seeing in Shanti Niketan, there is a tree in the campus of the in the university there, which is supposed to be 380 years